6 weeks ago, in the face of a growing number of cases of COVID-19 in our province, Alberta cancelled all non-urgent scheduled surgeries. And with cases emerging in all 5 of Alberta's health zones, we needed to free up medical personnel and beds for patients requiring hospital care because of the virus. To curb the spread of COVID-19, we also restricted visits to healthcare providers like chiropractors, psychiatrists, or psychologists, limiting visits only to those in need of urgent or emergency care. These were necessary decisions made with the health of Albertans as our top priority, but they weren't made lightly. I know that cancelling surgeries and other non-urgent healthcare visits caused disappointment and stress for many Albertans, many of whom had been waiting already a long time for an important procedure. And I appreciate your patience. And now it's thanks to those measures, thanks to our frontline healthcare workers, and thanks to the vigilance and patience of all Albertans that we are flattening the curve of COVID-19 infections. Alberta has done an excellent job in adhering to public health orders, and I'm pleased to confirm that today, as part of our government's relaunch strategy, that we'll begin to lift the restrictions on non-urgent scheduled surgeries. Starting this morning, AHS is proceeding with a mix of minor and major surgeries based on the determination that the rate of new COVID-19 infections does not present a significant risk to patients or staff or the capacity of the system. We'll take a carefully controlled and phased approach as we resume non-urgent surgeries. Patients who would be at greater risk if surgery was delayed any further will receive their care first. As we phase in surgeries and other procedures, we'll carefully monitor and evaluate to determine if more procedures can resume, like short-term overnight stays in hospital, for example. If our evaluation determines that there's too much at risk, we'll take a step back if we need to, because the safety of patients, the safety of healthcare providers, and the safety of all Albertans remains our highest priority. And as I said, priority will go to those patients who are at the highest risk by any further delays in surgery. In addition, independent allied health professionals, so this includes chiropractors, psychologists, physiotherapists, and other regulated professionals, will be permitted to resume operations. Our government is working with the professional colleges of these professions to develop guidelines for their members who choose to restart their services. This includes physical distancing, patient screening, care of patients with COVID-19, use of PPE or personal protective equipment, and as well cleaning procedures. The decision to reopen a clinic remains with the operator, as does the responsibility to determine their ability to keep themselves and their patients and their staff safe. In every aspect of Alberta's phased relaunch strategy, and every aspect of that strategy puts the health of Albertans at the forefront. Thanks to the measures of our government, as well as AHS, AHS and our government have taken, and the hard work and dedication of our frontline healthcare workers, our healthcare system continues to be ready for the virus's peak. The health of patients and healthcare providers remains our priority. We will rely on our healthcare providers to make responsible decisions as we move forward with resuming non-urgent surgeries. Together we'll move forward, get patients the care that they need, protect vulnerable Albertans, and get back to work and enjoying life in this beautiful province one step at a time.